Hi, I'm Dr. Jim.
And I'm Dr. Janine.
We wanted to bring you something in the news today because we think it's important to keep up with the news, especially about the health. And I guess if you've kept up with the news, you may have seen that AstraZeneca is withdrawing its COVID-19 vaccine worldwide, just months after the pharma giant admitted that the drug could cause a very rare but life-threatening injury. And AstraZeneca recently admitted that this vaccine, initially called Covishield, could cause these very rare side effects in blood clots, low platelet counts, and so on. I think people pretty well have got it figured out now that it's something that this is doing. It's causing this thrombocytopenia syndrome, which is characterized by something we've seen kind of rare, blood clots and low platelet counts in humans.
Right. And the low platelet counts and the blood clots can kind of go together. And that's why we've seen a real big increase in blood clots, pulmonary embolisms. There's a lot of stuff that the COVID, and of course your vaccine is the spike protein from the COVID.
Right.
So it itself causes a lot of problems. And we just wanted to tell you today, we've seen a lot of it. I mean, over the last 4 years, we've seen tons. And
we really have.
We were going to kind of give you a little bit of information on what we have found to actually really help when it comes to still having symptoms from COVID, symptoms after having the vaccine, just the spike protein of COVID itself.
Right. And when you start looking at the things this has caused, I suppose you've heard or read about the problem with clots. We've seen a lot of people with low blood platelets, and they never had a history of blood platelets being low. And that's a real problematic problem too for the folks that get that. But we've seen a lot of things, and a biggie that we've seen, and it hasn't been talked about quite as much as some of the peripheral artery disease where you get a blood clot in a vein in the leg or something. One of the biggies that we've seen, and we've had quite a few patients with it, is called PE, pulmonary embolisms.
Yep.
That's in the lungs. And when those pulmonary embolisms hit that lung, you're in trouble.
And like I said, you can't prove that a lot of it has come from that, but it is just kind of weird how since COVID has hit the scene, we've seen an increase in pulmonary embolisms, definitely blood clots, definitely heart attacks, cancer, and actually autoimmune diseases. Now, autoimmune, they do know that. I mean, a lot of the makers have said that's a rare side effect also of the vaccine is autoimmune problems. And we've seen a lot of that as well. So we just wanted to let people know, what can you do if you're in that group? I mean, what do you do if you're having symptoms? One of the things that has been researched and has come out a lot recently about helping with a lot of the problems because it helps dissolve the spike protein from COVID is Natto kinase.
Right. And we've talked about Natto before a lot. Okay.
Yes.
A lot. And if you go back and look at some of our other videos, we did one on how Natto can help reverse cardiovascular disease. And there's some others. And you'll find that, and there's a lot of really good research on, and as a matter of fact, there was a really big research paper, I think it was published in 22, that showed the Japanese did a study, and they did over 1,062 human subjects. So no mice were involved, okay? So it didn't harm any animals. But this was about humans, and they showed how it could reverse that cardiovascular disease, reversing that clotting factors, that cascade. They even compared it to something, and medically, we know there's a compound that we use called TPA. And TPA is tissue plasminogen activator. And we use it a lot in medicine today. For instance, if you start having symptoms of a stroke and you get to the hospital, PDQ, you got to get there fast because they've got a little 3-hour window from the time you first start having a symptom till they can give you that shot. They give you a shot of the TPA. But if you get there early enough, they'll go ahead and do a CT scan, determine that it is a clot, not a bleed type stroke. And if it is a clot type stroke, they can give you a shot of this TPA and dissolve that clot. Well, the Japanese actually compared the two, and they said, that Natto works as good as TPA.
Without the risk of bleeding to death.
Right.
I mean, that's actually one of the big things, is it's something that can be taken daily.
Right.
It can be taken preventatively, and it doesn't cause all the problems. Now, in some people, if they do a really high dose, it can make bruising.
Yes, it can.
We've seen that in a few people. Not a lot, actually, but we have seen it some. So there are things that, you can take, and you can take it as a preventative measure because, as everybody knows, COVID is still out there. and it still is causing problems with cardiovascular. And so some of the research that's come out on the natto kinase for cardiovascular disease, not even associated with COVID, just by itself, is unbelievable. So it is something that, as we age, it's a risk anyway. I mean, cardiovascular is a risk the older you get. And there's things that make it a higher risk. But natto kinase is very good at reducing a lot of the cardiovascular risk. And at the same time, natto kinase has been shown to actually help with blood pressure and blood flow and circulation. And I mean, who don't want that? So there's things that it does that, is very beneficial. Our product is called Natto Advantage, and we actually have the natto kinase in it, but we also have serrapeptidase, which is anti-inflammatory, and rutin, which strengthens all the vessels. So we have had very good results with our product, and we wanted to let people know. And then we've used it for 20 something years. So it's been a long time since we've had that product. But, now all this research is coming out how it dissolves the spike protein in COVID. So that's a big plus. And I've even read one of the articles that came out about it, one of the research papers that said if someone was taking natto and got COVID, they're less likely to get it in the first place. Mm-hmm. But if they do get it, they're going to probably have a milder case because it's going to dissolve the spike protein before it kind of takes hold. Mm-hmm. So that's kind of what you want. The other group of people that come in are the people with long COVID. I mean, that's another group of people that are having problems where they just say, I've not been the same since I had it. And we have had really good results clinically using a few things together for long COVID.
Now, one of the biggies that we use a lot along with natto kinase is N-acetylcysteine, or NAC. Mm-hmm. And tell you how good NAC is. FDA almost tried to take it off the market earlier this year.
This year. It was a few years ago.
No, it was last year.
Okay.
Well, within the past year or two.
Years, yeah.
They've tried very hard to, well, we're going to take this off the market because it's blah, blah, blah. Yeah, because it worked.
Well, it wasn't because it was any problems and there was no side effects. It was because it is used in the hospital setting because it does work for clearing the lungs. It does work for detoxifying. If you go in with a Tylenol overdose, it's what's used in a hospital setting. Right. So they wanted to say, well, it's a drug, not a supplement, so we need to take it off the market. And it really didn't take. There was too many people that fought back because NAC is something that's been out for years. We have used NAC for years, and it's very inexpensive. And if NAC became pharmaceutical only, what would happen to the cost. And so
and the availability.
It'd go way up.
Yeah.
So a lot of people fought back on the NAC, and it didn't get taken off the market.
Right.
And NAC has had research also that it helps with reducing the spike protein.
Yeah, it actually degrades. There's some pretty decent research a year or so ago talking about how it degrades or gets rid of, it breaks it down, that spike protein. And that spike protein is the real killer.
Right.
I hate to use that word, but it is.
It
killer.
is.
It is. It really is.
So we use the natto Advantage, the NAC, and then if somebody still has long COVID, we use Olivir, which is antiviral, and it does have some antioxidant effects, and then our SPM Select, which is really good at stopping the inflammatory response and help healing the problems from the inflammation. There's even been some really good studies that SPM, since COVID's come on the scene, about how it can even help with some of the scarring in the lungs from COVID.
Right.
So those four things, the natto Advantage, the NAC, the SPM Select, and the Olivir, huge difference. So people out there that are having problems, there's no need to suffer. You can actually take stuff and see if it helps you. And in a lot of the cases, I would say majority by far of the cases we see, it does help.
Yeah. And I would just, this is what we tell people every day. If you come in to our office and say, okay, what do I need to do? Well, the first question we're going to ask is, were you vaccinated? I don't care what vaccine you took. Were you vaccinated? And if they say yes, okay, then you want to be precautionary. Now, if you're vaccinated and got COVID, which we saw that a lot,
yeah, a lot.
Really.
A lot of people are on
and if we do see that a lot, we really do. So if you're vaccinated and you got COVID, you're running a double whammy, and you really, really, really want to protect yourself as much as you can because there's a train coming, and it's liable to get you if you're not careful.
You just want to be healthy overall, like we tell people every day.
Yeah.
Prevention is the key. Stay as healthy as you can be. You don't want to wait until you get sick.
Right.
I mean, as a whole, it's people's human nature to wait until something's wrong. Man, when COVID hit everybody all of a sudden decided it was real important to be healthy.
Yeah.
So it was amazing, the influx of people that all of a sudden decided that it was important to be healthy. Well, it's important to be healthy all the time. I mean, we're even seeing in the news these other viruses that they're saying possibly can become, in humans.
Yep.
You never know what's around the corner. You never know what's there. So the healthier you are, the better your body is equipped to deal with it if it does come.
That's true.
So, but people, out of sight, out of mind is really big, because if it ain't happening and it's not big in the news, everybody kind of forgets. So we just kind of wanted to tell people there are things out there that you can do, and there's things that you can do to get yourself healthier. And it is important to stay healthy and keep the immune system healthy, because that does make a difference with whatever is coming down the road.
Yeah, but just on top of that, though, we want to stay healthy.
Yeah.
And at the same time, though, we really want to do some things to protect us from this thrombocytopenia syndrome, which is what they call it. Basically, when you start having clots, you have a lot of the blood clots and so on start showing up. And if you think, or somebody in your family had something like that, you haven't had it yet, but you're set up. You had COVID, you maybe had the vaccine or whatever. Whether you did or didn't have the vaccine doesn't seem to matter. But even if you did, you definitely want to do something that helps protect you. And that's something like this Natto, the NAC. You've got a lot of people.
You can even do some of the glutathion for detoxification.
Oh, yeah.
So the glutathion, there's a lot of things that can be done, and it just depends on the person and their health overall, what all needs to be done. Right. But there is things out there. So, when COVID hit, we saw some weird things on lab work. There is no doubt that when we would do labs on people that had COVID, and sometimes we didn't know they had COVID because that's why we were doing, they just thought something was wrong and they didn't know it was COVID. The inflammation markers were off the charts. It was amazing the amount of inflammation that COVID caused the body. And then the fibrinogen, which people always say, what's fibrinogen? Well, it's a precursor to fibrin, and that's the strings that hold together clots and plaques. Right. Off the charts. CRP off the charts. The fibrinogen would be off the charts. We would see such high levels in people that had COVID. And in most cases, not all, the white count, which is normally elevated with being sick, would fall. It was kind of a real strange thing that we saw, how it made the immune system actually go down. And that was something that we've not really seen before with other acute problems.
Right.
And so, it's something different. It's still out there. You still need to protect yourself. And there is things that you can do.
Yeah.
At first, really nobody knew what to do because there wasn't much research out about it yet. But now there is. So now there are things that you can do. So why not?
Right.
Yeah.
So, hopefully you got something that can help you, live healthier and as we say, live healthy and be healthy. Mm-hmm. And you have to live healthy to be healthy. So just start right now, and maybe some little things. Like I say, if you've got any of these risk factors that are coming at you like that, this time to start doing something proactive. Be very proactive about your health, because that's the big key that we stress all the time. Be proactive. Do something good for yourself. So hopefully you got some good information here, and you can actually live healthy and be healthy. And thank you for watching. I'm Dr. Fox, and I want to thank you for watching this YouTube video. Be sure and hit that subscribe button, hit that little bell so you'll be notified on any upcoming videos that we have coming up. And thank you again for watching our YouTube videos.